So I'm going to go ahead and turn it on over to Emery and Lauren, who are going to talk to us about the dental health dashboard.
Thank you so much, Sarah. My name is Lauren Harvey. I am the Director of Government Relations for the Colorado Dental Association, and I will be happy to do this presentation with Emery, who will talk through a lot of the actual data. But we're very excited to talk through this, a commercial dental health analysis that we partnered with Civic on this year, and we are thrilled with the information that we now have publicly available. You can go to the next slide. So the purpose of this project that we undertook. So obviously, it goes without saying that oral health is a vital part of overall health and well-being. It's something that we talk about all the time. If you have poor oral health, chances are you also will have other issues with your overall health that are going to impact you on your day-to-day life. So it's really important to understand how we can increase access to dental care and especially preventative dental care. So we partnered with Civic to introduce an interactive dashboard which will provide a clear picture of dental care in Colorado. So we asked them to look at commercial claims across Colorado for these 3 years and have them now publicly available in this dashboard. We're really thrilled with this because we do believe this promotes a greater public understanding of utilization, trends, and it's also, whether you're a consumer, a dental provider, other provider, a policymaker, or an advocate, this data can really help drive conversations, best practices, and also policy changes that may be needed to increase access to care. And this kind of data really hasn't been available in the past. We've sometimes relied on self-reported data from providers or trying to get information from insurers. So this is really a great tool that we now have publicly available. And on the next slide. So just wanted to share some reasons why we are hopeful this will be really impactful for Coloradans and some use case examples. Um, as you can see here, there may be an opportunity to identify if there are disparities. So if we see, lower utilization in rural parts of the state for certain codes, that may tell us that we should be doing some investigation and research into what may be happening and if there's a need to identify barrier access and barriers to care. We also are hopeful that this can help us inform our public programs. We know that having some benchmark data for our Medicaid program is especially helpful. Um, Medicaid often benchmarks to Medicare, which is not available for dental. So this is even more important in this area of medicine, of dental, to have an opportunity to identify what actual costs and actual payments are so that we can incentivize the public program to be sufficient and adequate and allow more Medicaid patients to receive dental care as well through having more providers involved. And we just really are interested in having that greater transparency into dental payer rates and utilization so that we can have greater transparency around the value of dental plans and really bring transparency to any health equity considerations reflected in current reimbursement models and looking at, subsequent reforms that can help improve health outcomes for sometimes overlooked populations.
Hey everyone, my name's Emery and I am a healthcare data analyst here at Civic. And I am excited to share our new dashboard with all of you. But before we hop onto that, just want to briefly touch on our methodology here. This analysis includes commercial dental claims data from the Colorado All Payers Claims Database for calendar years 2022, 23, and 24. It explores trends in utilization and cost using our current dental terminology codes. And it also provides breakdowns for various cost measures listed here. I went ahead and I dropped the link in the chat for those of you who would like to follow along. I encourage you to navigate there as I also try to gracefully share my screen. Alrighty, we should be able to see my screen now. Before we drop in, I just want to share that when navigating to dashboards through the Civic website, you can do so by going to this Get Data button. We can then navigate to public data and featured focus areas in order to explore all of the dashboards that Civic has available, including the dental health analysis, which we will be exploring today. Within the website, there's a ton of other really useful information about our dashboards, including our specific methodology and summary of findings, which I encourage you to dig into after this presentation. Scrolling down, we will then find our awesome new dashboard, which hosts 3 different pages. First, we're going to dive into our cost tab. We have 2 specific views on this tab, which we're able to filter using our filter bar above. Here we have our years, which include 2022, 23, and 24, geography options such as statewide, rural, and urban, and then our specific cost measures, including the allowed amount, charged amount, health plan only, and patient only. If you are curious about the definitions for those, you can hover over our information button and it'll provide you more details on that. Orienting ourselves with the dashboard itself, there are 2 primary views on this page. The first view includes CDT codes with the average payments and then percentile payments, where the 25th percentile payment represents payments that 25% are below this value. Again, if you want more information on these definitions, you can hover over the information button and it'll provide you with information for that. One of my favorite parts about this table is that it's interactive. And so if we select a CDT code on this table, it'll then populate the visual below. And so now we're able to see the variation in allowed amount by commercial payer. So we can see the minimum, median, and maximum payment by commercial payer. But my favorite part is that if we have a CDT code that we know, or a group of CDT codes, we can type it into the bar here. So for example, say we wanted to look into imaging services. We can type that in here and it'll filter to all of the imaging CDT codes available, and we're able to easily compare the costs. Making it even better, we can sort by the highest to lowest, easily making it so that we can compare the values. Moving along, the demographics tab, of course, is public health professionals. We know is a great place to go to better understand the disparities that exist. Before looking into this dashboard, I just want to highlight there are 2 different sets of filters we want to be aware of for this page. The first set has the year and geography, like we already navigated through on the first tab. It also has the demographics options, which include age group, race, ethnicity, and sex, as well as our measure groups. For cost measures, we include the total cost as well as cost per person per year as well. And then for utilization, we include total utilization, which represents the total number of services, as well as utilization per 1,000 people. Now, not forgetting that second filter, you can either compare cost measures to the utilization, or it probably makes sense to have it more concise and select another utilization measure to compare. In order to easily compare our demographic groups above to the trends, by hovering over, it'll bring a specific demographic group of interest into view. Finally, we have our top CDT code chart. We get a lot of questions about this chart. So again, I really want to encourage you to use this information button for additional information. It has great definitions of what exists here, as well as friendly examples of how to interpret the data, because we all need that sometimes. So for example, here we see for 0 to 17-year-olds, periodic oral evaluations make up 20% of billed services. Finally, last but not least, we have our Trends tab. This tab is going to automatically populate with all years of our data and all different geography options. So with that, I just want to highlight that the text bands at the top here are all going to represent statewide values with all years included. However, if we want to look at a specific data year, we can select one of our analysis years, so 2022 through 24, or we can select a specific geography of interest, and it will filter to those specific values. Finally, we have all of our different utilization and cost measures here as options for filters. The last thing I want to touch about this dashboard is that we have the option to download any of these images so you can throw it into a presentation or send it quickly to a legislator. Love to see it. Again, I know this is a really quick run through of the dashboard, so if you have any questions, you're always welcome to send them my way, or if you have questions now, you can drop them in the chat. Thanks, guys.
Awesome. Thank you so much, Emery. I'm going to go ahead and take back the screen here. We'll open it up. Looks like you've got a question from Lucia in the chat while I go ahead and deal with this.
Yeah, thank you, Lucia. It says, how can the information available in the dental health dashboard impact access to care? I would just note, I think having the data in general will help us identify first and foremost where there may be, lower utilization levels. And that might tell us, is there a reason that there's less utilization of a certain code in rural areas versus urban? And I think that opens the door to us doing some further digging and guides us in investigations of where we may need to look, are there, certain providers aren't available in that area, and how can we increase access to those provider types in dental? So I think that's, one way where it really can, just having the information available lets us identify where there may be a need and begin to explore why there is a need and what the barriers may be in a certain population or part of, the community of Colorado.
Awesome. Just give it a couple seconds more here if there's any